I will give a brief talk on atopic dermatitis and its management. Hello everyone, I hope each and everyone at your place is safe and doing fine. I am Dr. Dilip Kumar and I have more than 30 years of experience in the field of dermatology, and I practice at present in Ramgarh, Jharkhand. Today we will understand atopic dermatitis and its management. What is atopic dermatitis? Atopic dermatitis is also known as eczema. It is a skin problem that causes dry, itchy, scaly, red skin. It can affect infants, children and adults and seems more common in certain families. What are the causes of atopic dermatitis? Although the cause of atopic dermatitis is not completely understood, genetics appear to play a strong and positive role, and people with a family history of atopic dermatitis are at increased risk of developing this condition. In most people with atopic dermatitis, there is a genetic abnormality in the outermost layer of the skin called the epidermis. The epidermis is the first line of defense between the body and the environment. When the epidermis is intact, it keeps environmental irritants, allergens and microbes from entering the body and prevents the skin from losing too much of water. In people with atopic dermatitis, this barrier is less strong and more permeable than it should be. Despite popular belief in certain children, atopic dermatitis is rarely linked to food allergies. If you think your child might have a food allergy, you must consult an allergy specialist for further evaluation. What are the symptoms of atopic dermatitis? Most people with atopic dermatitis develop their first symptoms as children before the age of 5 years. Intense itching of the skin, patches of redness, small bumps and skin flaking are common in atopic dermatitis. Scratching can further inflame the skin and worsen the condition of atopic dermatitis. The itchiness may be more noticeable at night time. Its symptoms vary from a person to person and can change over time. Although eczema is usually limited to specific areas of the body, it may affect multiple areas in severe cases. In infants, there may be red, scaly and crusted areas on the front of the arms and legs, cheeks or scalp. The diaper area is usually not affected. In children and adults, eczema commonly affects the back of the neck, the elbow creases and the backs of the knees. Other affected areas may include the face, wrists and forearms. The skin may become thickened and darkened or even scarred from repeated scratching. Scratching can also lead to infection of the skin. Signs of infection include painful red bumps that sometimes contain pus. If you think you might have an infection, you must consult your doctor, maybe a dermatologist or nurse, as you may need prompt treatment. Other findings in people with eczema can include dry, scaly skin, plugged hair follicles causing small bumps, usually on the face, upper arms and thighs, increased skin creasing on the palms or an extra fold of skin under the eye, darkening of the skin around the eyes. How to diagnose atopic dermatitis? There is no specific test used to diagnose atopic dermatitis. The diagnosis is usually based upon your medical history, symptoms and physical examination. However, increased IgE levels in blood serum may give a clue to the development of atopic dermatitis. Factors that strongly suggest atopic dermatitis include long-term and recurrent itching, symptoms that began at a young age, and a personal or family history of certain allergic conditions including asthma and seasonal allergies, as well as atopic dermatitis. Another factor to consider is symptoms that get worse after exposure to certain triggers. What is the treatment of atopic dermatitis? Atopic dermatitis is a chronic condition. It typically improves and then flares get worse periodically. Some people have no symptoms for several years. It is not curable, although it is possible to control your symptoms with a variety of self-care measures and medications advised by the dermatologist. Who treats atopic dermatitis? Many people with atopic dermatitis can initially be treated by your primary care provider. However, you may need to see a dermatologist skin specialist in certain situations, such as if your skin condition does not improve with treatment, or if certain areas of your body are affected, face or skin folds, or if another condition could be causing the symptoms. Identifying triggers, eliminating factors that aggravate your symptoms can help to control the symptoms. Possible triggers of atopic dermatitis include cold or dry environments, sweating, emotional stress or anxiety, rapid temperature changes, exposure to certain chemicals or cleaning solutions, including soaps and detergents, perfumes and cosmetics, wool or synthetic fibers, dust, sand and cigarette smoke. Please consult your dermatologist for further details, if any. You must consult your dermatologist at any cost if atopic dermatitis gets worsened or if you require medical help. Thank you very much.